one of the sequelae we talked about already is the physiologic appearance of what's going on in acute acidosis. Diarrhea, respiratory character changes, laminitis. One of the other sequelae that we believe that is related really hits home where stuff comes together again, that's liver abscess formation. Liver abscesses aren't unique to grain-fed cattle. Baby calves get them. They tend to be hematogenous through navel ill or from septicemia, because the liver is a pretty good filter. Dairy cows get them, even though they're on relatively high roughage rations. They certainly do a lot of acid generation. They're certainly prone to develop ruminitis. But where we think a lot of them come from is via the portal vein, that short little 2-inch trip from the rumen into the hilus of the liver, where blood's going for the purpose of processing these, by and large, to process the VFAs into glucose to make the energy stores. So it's a really important trip, but if all's not well in the rumen, that important trip can carry with it a lot of bacterial load. This is one of Nog's pictures. This is the bovine liver that's just loaded, just showered with these little, with these small multifocal abscesses. There's hundreds of them there. This is an experimental one. This is a liver. This is a calf that received an intraportal injection. So this is all normal liver. We can pick this little guy up on ultrasound. So we continue to work on models to help assess product utilization. One of the real frustrating things about working with liver abscesses is in feedlot cattle is that when we model to get power, we tend to do lots of small pens for things, and the feeding dynamics and the socialization, the lack of bunk pressure tend to make it a little bit frustrating. And we have to wait such a long time to get definitive data. We take them to slaughter, maybe 200 days later, all excited because we saw this intake variation, and we throw a party and the abscesses don't come. They tend not to. It's difficult to get incidence as high as we tend to see in certain groups of cattle. So we do a lot of modeling with that. Here's another one. So this is an abscess that's 7 days old. There's a capsule there. There's a solid center. Here's an abscess that's only 3 days old. So this guy's got a purulent center, starting to get some capsule formation around it already. This is another view of that. So the changes can occur fairly fast following insult experimentally. So the bacteria, we talked a little bit about where they come. They can come umbilical, baby calf. In theory, they can come from peritonitis, although that's not very common. In theory, they could come through the bile duct. We have incidents of that. So cattle with flukes that have bile duct infiltration, yeah, so that can be part of it. You can get liver abscesses related to that. Systemic, it can come through the main circulation, but in reality, we believe that almost all the liver abscess pressure in fed cattle is coming through the portal vein. We saw this picture again. We were talking before about acidosis, so we had different cartoons here. This cartoon says what we think happens is we form ruminal wall abscesses, or at very least abrasions, to make that tissue susceptible to bacterial colonization and a bacterial emboli go into the liver. These bacteria, I'll fly through a few slides here that Nog had in his set talking about the different species, but by and large we're talking about Fusobacterium necrophorum, Saurophorus necrophoros, for those of my age and older, that's what I first learned it was. But it's the same gram-negative, anaerobic gram-negative rod that's been around for a long time. It occurs normally in the rumen at around 1 × 10⁵ to 1 × 10⁶ in roughage-fed rations. So that's about 1 million cells per mil, or about 1 million cells per gram. So it's around. I mean, that's around pretty high, actually. So it's always there. When we get acidosis going on, and we set this tissue up, and I'll show you some pictures of some experimental acidosis induction models, it's pretty easy to see this short trip. Bacteria goes to the liver. Now, the liver's got a really good immune system. The Kupffer cells in the liver are part of the macrophagic cell line. And if it weren't for the leukotoxins the bacteria, Fusobacterium produces, there probably wouldn't be abscesses. The leukotoxin, the defense mechanism that the bacteria has, is very similar to that of Mannheimia hemolytica. So the ability of this bug to fight off the defense system and go ahead and form an abscess is part of their defense mechanism. So when we chart percent abscesses relative to ruminal lesions, this is some data of Rezax in 14. We can see that as ruminitis evidence increases, abscess rate increases. That's not causal, that's relationship data. We think this is true, but still kind of working on it. Here's a mild rumen lesion. This is a calf that we experimentally induced acidosis into. You can see some reddening there. So that's minor compared to what we're going to see. When you look at the cut thickness of that, there's actually a rumen wall abscess right here that you can see grossly. When you look at that on histo, you've got inflammatory cell infiltrates, you've got a lot of neutrophils. Here's another one that's actually a rent. So this is not cut with a knife. I do get a little careless at necropsy, but that's not what caused this. This guy had a scab all the way around it. That's a full thickness rumen lesion 14 days after he was dosed with the procedure we showed you about. Here's the pillar of the rumen. So this is not denuded by acidosis. That's an area when you open them up that normally doesn't have papillae on it, but you can certainly see some ulcers here and some lesions at the tip of the knife. Another shot of a rumen pillar with a lot of these infectious lesions going on. This one actually has the necrotic membrane on it. You could peel that scab off, so calves get pretty severely affected. And it can result, here's a cross-section of a liver abscess laying right beside the rumen lesion from that same calf. And we'll isolate Fusobacterium out of these. We haven't done any sequencing to confirm that bacteria is this bacteria, and quite honestly, it may not be. This bacteria is part of a really mixed pool. We know they're both Fusobacterium, and they're probably the same, but the rumen irritation can be so severe that you can colonize the liver with lots of different stuff that comes along for the ride. So when you do isolation, right, this was some of my thesis work back in the mid-'80s. 100% of the ones that we looked at had Fusobacterium. Some of them had, at that time, we called A. pyogenes, and there's other bacteria mixed in, but it seems that the obligate part of that equation has always been Fuso. When we look at these on ultrasound, so just to put it in perspective, we're between the ribs. The liver of cattle is held up against the right body wall by the rumen. So if you ultrasound horses, it looks different than if you ultrasound cattle. The liver extends from, so cattle have 13 ribs, so they have 12 intercostal spaces. At the 12th intercostal space, you can see the tip of the liver and the right kidney. As you move cranially, you have enough space, depending upon the age of animal you're working with, you can usually scan 12, 11, 10, 9, 8. And so we can see about 70 to 75% of the volume of a liver with ultrasound. And when you look at these guys, so here's the skin, my transducer's up here, here's the skin, intercostal muscles, caps of the liver. I'm shooting down through the thickness, looking toward the rumen. Liver parenchyma, this is portal vein, thick wall, this is hepatic vein, and the backside, and this is a lymph node, this is a ruminal hepatic lymph node. This is the formation of an early abscess. So you see a hyperechoic area, there's no capsule around it yet. Here's another one. This one has got a little sharper center and he's just starting to form a capsule. This guy's actually got several foci. So we found experimentally and then also following some of these natural ones, the great big A+ nasty abscesses that you cut into that appear to have different centers. It's like, well, there's an inspissated chunk of pus here and here and here, but it's all encapsulated within one capsule. It looks like those happen that way, and by some mechanism, the body decides instead of making 4 little abscesses, it's saying, what the hell, let's just wall this whole area off. And you end up with a really big abscess. Why that matters is little guys, those less than a centimeter in diameter, if you follow them long enough, tend to resolve. The big guys don't. That might be because we intervene later on. We maybe don't give them enough time. But an abscess that this is headed to be, that's going to be an A+ abscess, is probably going to be there till slaughter, even if this guy feeds 150 days yet. Here's another one, pretty well organized. This one's just against the capsule. This one's going to have an adhesion, so he's probably going to be, the diaphragm's going to be tacked to him, because that's the other thing you're shooting through. You're firing through the external and internal intercostal muscles. You're looking through the diaphragm. You're looking through the capsule, liver, and then the parenchyma. All those first things, depending upon the age of the calf, and you don't have too big a fat layer, maybe a ½ inch. So you're pretty close to your work, so you can get pretty good resolution on these guys. The other bacteria, there's not going to be a test on this because I can't pronounce most of them, but there are others in there. If you look at enough livers, you'll find other stuff going through. There's the one that matters, Fusobacterium necrophorum. We used to call them biotype A. It's now called subspecies necrophorum, or biotype B funduliforme, again of academic interest only. Virulence in mice, A is the bad guy. Okay, so subspecies Fusobacterium is the one that matters. We see it in mixed, and for the essence of time, we're going to zip through a few of these. Recognize that it does have virulence factors. It's not just by chance that it's more virulent than the other. It has a leukotoxin, a hemolysin, and a glutination factor. So it's equipped with several tools. One of the tools it doesn't seem to be very well equipped with is the ability to develop resistance. We've had lots of discussions and been involved in quite a few investigations over the years where cattle might be on a product to prevent it and they still blow through it. We haven't been involved in any where we found out that that's resistant to tylosin, for instance, which is the major one that we're using. It's usually just the fact that this equilibrium that has to exist, that we simply blew past the thresholds, and not that we have resistant bacteria. Leukotoxin production relative to growth time, it's fast, faster than bacterial, faster than the cell counts would indicate. The only message there is developmentally this bacteria is figured out. Leukotoxin matters more than how big your army is. This is how good is your weaponry compared to how big is your army. These guys, once they get in the environment that they want to set up infection, they really build leukotoxin in a hurry. We're not going to spend a lot of time talking about Arcanobacterium C. pio. It's there, it's relevant. It seems, in our experience, to always be associated with Fuso. So I think controlling Fuso is the secret. Different studies will show this at the old C. pio bug at different infection rates. This data that NOG has in here was 15%. I've seen it as high as 40%. I have yet to believe it's the primary causative agent. We've never found it without a significant amount of Fusobacteria involvement. It is a gram-positive rod. It's very easy to diagnose. If you've cut into cow abscesses, you know what A. pio looks and smells and feels like. Really sticky. It doesn't, and you can tell in these liver abscesses when you have involvement with it without doing culture work. Distribution, rumen wall abscesses. A. pio is a higher component of those wall abscesses than it is of the liver contents and abscesses. So certainly it is a pathogen. Little data, this is some Elanco tracking data. Are Holsteins real cows? Yeah, that's an age-old question. Yeah, so we see a lot more of them on feed than we used to based on our production systems and our calf-fed Holsteins. Incidence rates, so this is years, this is 10 years worth of data. The red bars are the Holsteins, the blue bars are the beef breeds. They're higher. They're higher either because they're fed longer or they are genetically more susceptible, which because they're of a narrower genetic pool, that's very believable. Most likely both of those things are simultaneously true. But if you're working yards that do a lot of Holstein feeding, you're going to have higher abscess rates than you do in the beef calves. Not every pen, but in general, you can count on that being true. Abscess rates, have been trending up. We continue to optimize performance. The decisions being made in the commercial cattle industry today are primarily driven by economics. When you say, if you showed me a closeout and the only piece of data that you gave me was the liver abscess rate in the cattle and you let me choose between a pen, all else being the same, okay, so same farm of origin, same everything else. One pen had 0% liver abscesses and one had 20% liver abscesses, but I can't see the closeout and I got to pick one. I'm not going to pick the 0. And the reason I'm not going to pick the 0 is there's probably been much more energy spent on maintenance in that group of calves than those that have been pushed a little harder. I'm not suggesting that's right or appropriate or societally acceptable, but our market's driven by the economy, and those are the kind of questions that we're going to have to answer. I don't know it's possible that we'd ever put cattle into a system where this number is going to be 0, but we certainly know how to feed cattle without antibiotics to make the numbers less than they are now. But we may or may not still be in business, so those are things we have to continue to think about. So this is a graph of A pluses. Generally, as total abscessation rate goes up, A pluses go up. These are the ones we actually care about. The smaller abscesses tend not to have detectable levels on performance. The A pluses do. The A pluses represent downtime in our slaughter plants. They represent increasingly bad image for our industry. If our goal was to go out and take a bunch of pictures today and see how bad we could make having beef for dinner, how bad of an idea we could make that look, this would be on your list of your photo tour. So liver abscess at the A plus level is at very least aesthetically unpleasing, and it has a negative impact on our performance. Generally, Holsteins are going to run 20 points higher than beef cattle. One could argue the details of that, but I don't think can argue with higher. We care a lot about the ones that have adhesions. This is liver tissue with a chunk of diaphragm hooked to it. That's not the way God made them. The diaphragm is supposed to flow smoothly across the surface of the liver. So that represents a microbiological infection that really blew up. Here's that same thing in cross section. I'm going to roll on to get to some other ones here. So I will spend a little bit of time on this slide, though. Hot carcass weight in this set of studies, when we get to the A pluses, we start to see a negative effect than what we do on the lower abscessation rate. So what drives it? Days on feed. We talked a lot about things that drive acidosis, I think also drive liver abscess formation. Those two maladies in cattle are correlated. I suspect it's causative, but they're at very least highly correlated. Here's a good one. What effect do we have on the immune status? As we learn more, does acidosis have an effect? I suspect it probably does. Do liver abscess formation events have an effect? Maybe. But they're all learning opportunities for us. A plus from Holsteins, again, 100% of the Fusobacterium isolations, about 40% of the A pios. A pio looks a lot different. That's an aerobic blood auger plate, so that's a 5% sheep blood auger, big white fluffy colonies. When you incubate it anaerobically, you get a different look. Flip through a few of these. I didn't do a very good job of estimating time. So bacterial species isolated. Again, just total counts. I should probably flip. Bear with me here. I should probably go sneak through. I've got some. So this one's one worth talking about. The MIC, the minimal inhibitory concentration of tylosin, on the Fusobacterium species. Still very susceptible and not affected by whether Thailand was included in the ration or not. So cattle fed Thailand had the same MICs for the bacteria that are isolated from liver abscesses as the cattle not fed Thailand. So antimicrobial susceptibility changes tend to occur in a relatively short period of time. So within cattle that are on feed for the duration, if we're going to see an effect, we should see it by the time those cattle go to slaughter. NOG had done some work and participated in work where they did DNA extractions and gene amplification just to get a sense for the total diversity going on in the liver abscesses. And you can see these are different phylogenetic level names for that same bacterial list that we looked at. But even though Fusobacterium is present in 100% of the abscesses that we culture, it only makes up about 50% of the total populations represented. So there are a lot of potential other organisms there, and these are different breeds: Holsteins with Thailand, non-Thailand, beef breeds with Thailand, non-Thailand. I don't think it doesn't change our assessment that Fusobacterium is the organism of interest. Tylosin feeding doesn't seem to be changing that susceptibility pattern. So Holsteins, kind of in summary of some of that work, Holsteins have a higher abscessation rate than beef cattle, all things being the same. Their incidence of A+ is higher. We didn't show the data here, but there are regional, the regional differences, I think, tend to be related to feedstuff utilization and how fermentable the products are that we're putting in the feed bunk for the cattle. I think it also has to do, the seasonality with location has to do with feed intake patterns in cattle and how well we manage that. And any areas that we have access to gluten feeds, to where we're using more complex rations, where we tend to see lower rates of abscessation than we do when we're in primarily steam flake rations. So I'm going to quit with that and see if anybody is still awake, if we have any questions. Yes.
I wanted to ask if there's evidence of pain and suffering with animals that have a liver abscess.
Yeah.
And it sort of is the heart of a welfare issue, because most diseases or pathology, there's some evidence change of behavior, and we see pain and suffering, and then it's an automatic link, that's a welfare issue. But is the presence of the abscess evidence that it's a welfare issue, or is it evidence of history that they had suffered something in the rumen that is a welfare issue? Tell me how the welfare
that's
connect
great.
this.
It's a great question. To the extent that I know, so we talked about acidosis, and there's clearly physiologic indicators that I would perceive as pain and suffering. With livers, we'll see acute formations, either experimentally induced or naturally occurring, where we've got pressure with an ultrasound transducer literally this far above, and based on the evidence the calf would show us, movement, away, anything like that, there doesn't seem to be. Keeping in mind also that pain receptors in the intestinal parenchyma are different types of pain receptors than we have in muscle and skin. So there are certain infectious diseases in pigs and cattle that seem painful. Salmonella in cattle seems like that's a painful event. I haven't seen evidence that this is. Interestingly enough, unless there's really severe abscess formation going on, ClinPath parameters don't change noticeably, rectal temperatures don't go up noticeably. When we have an experimental model where we can put Fusobacterium into the portal vein, and at levels that give us low levels of abscessation, we don't see clinical abnormalities in those animals when we're looking at depression, abdominal score, feed intake, rectal temperature. At higher levels, they do. At higher levels, it's common to see rectal temps in the 105 range. During that acute inflammatory process, it's common to see cattle ganted up and walking a little tight. And that's independent of any laminitis going on, because it's a different procedure. So if I expand that to feedlot cattle, I think if we see them clinically, we treat them for something different. I think we see these cattle in our feedlot operations, if it's an all-natural yard, we pull them out of that pool, we suspect they're a BRD, that ain't doing right. And usually they're associated with that acidosis thing going on also, so we can check all those boxes and feel pretty good about our use. We give them an antibiotic. This bug is susceptible virtually to everything we would use for respiratory therapy. And so we maybe don't let a lot of those cattle extend into the fullness of their disease. An extension of that is even these A+, I think if they caused very much pain and suffering, we would in fact be treating them as something else as we go, which begs yet another point, is what's our real abscessation rate in conventionally managed cattle? It might be notably higher than what we perceive it to be looking at slaughter data, because we might mitigate quite a few of them. That's a really long-winded answer that I didn't answer very well, but the little guys I don't think, in my experience, cause much. The severe ones, I suspect they do at some level, which is a very fair argument for saying if we have something that we're using that helps control that pain and suffering, that's part of the discussion.
Another question?
My question is about actually dealing with groups of clinically acidotic cattle. And within certain groups, what's the long-term outcome on herd-on performance and everything else. But once we've identified these groups, can we manage them differently after the effect, after they've recovered, to increase their productivity and performance?
Yeah, another good question. We've not done as much acidosis modeling as we have with liver abscesses, but the propensity of cattle to recover from those and re-epithelialize the rumen surprises me. I'm sure it depends on how much total percentage involvement. I think they'll naturally self-manage to some extent. If they've been bitten, I think they'll help you not develop acidosis again, but where they're prone, they may be genetically prone, and I would tend to back those cattle off a ration. Generally tend to feed a ration that's got a little more roughage and a little less grain in it. And keep them on an ionophore.
One more chance for questions? Thank you very much.